The cells are not, they weren't being cleaned. And with a lot of noise around that, they started spraying a sanitizer. And come to find out, the sanitizer that they're spraying to supposedly sanitize cells is Wexide 128, which has an ingredient of pesticide, which is in it. And they're literally poisoning inmates. That is what they're doing during a pandemic. They're poisoning people now.
Prisons across the country are overwhelmed with outbreaks of the coronavirus. As of May 13th, by official numbers, 25,239 people in U.S. prisons tested positive for the virus, up by 25% the week before. Additionally, 1,000 ICE detainees tested positive. The CDC reported that across 37 states, 88 inmates and 15 correctional officers died from the virus between January 21st and April 21st. Unfortunately, these numbers are nowhere near reality. There's been no cohesive effort or plan to test prisoners across the country. Countless cases and deaths are going unreported.
Last week, we also had a vigil outside of the women's prison, one of the women's prison, where the population is, I think, 195, and out of that 195 women, 192 has tested positive for the virus.
So the prisons have not provided comprehensive testing for anybody. Where they have provided comprehensive testing, we've seen upwards of 80% and 90% infection rates.
So why are inmates suffering such high rates of COVID-19 and related deaths?
A lot of things that have been happening that, I've been able to hear is that a lot of the people that are incarcerated are sick. They've been, they're sick. And instead of getting medical attention when they're showing symptoms of COVID, they're placed in solitary confinement without any medical attention, without anyone to even see how they're doing. And they're just kind of leaving them there. Or they're leaving them in the cells and the roommates or cellmates are, sending it back and forth. So there's really no precautions going on. The cells are not, they weren't being cleaned. And with a lot of noise around that, they started spraying a sanitizer. And come to find out, the sanitizer that they're spraying to supposedly sanitize cells is Wexide 128, which has an ingredient of pesticide, which is in it. And they're literally poisoning inmates. That is what they're doing during a pandemic. They're poisoning people now.
People are living on top of each other where they are living with 140 people effectively in the main. And so with coronavirus, a highly contagious sort of airborne disease, there's absolutely no way to physically distance. There's no way to do it. In the Hightower unit in Texas, I've just received a letter from a very good friend of mine, Bakari. It's a misdemeanor to congregate in groups of larger than 10, but they live as 120. But now they're criminalizing any congregation in a place where you can't but congregate.
Prisoner advocates nationwide have been demanding immediate bail reform, as well as compassionate release, or at least home confinement for large numbers of inmates, especially elderly prisoners who have served decades behind bars, as well as those with pre-existing conditions. But so far, less than 10,000 of the country's 2.3 million prisoners have been set free.
Well, I think when we look around different countries in the world, Iran, the Islamic Republic of Iran, has released roughly a third of their prison population. Over 85,000 prisoners have been furloughed for the duration of the crisis. And Turkey has also released thousands of prisoners. And I think that it's interesting because, these are basically realizations by government authorities in other countries that to the extent that they can't keep the prison population safe, they need to reduce the prison population. I think, the goal of not turning their prisons basically into death camps.
I think that prisoners need to be released. People that are incarcerated, men, women, children in the Department of Juvenile Justice, need to be released and given proper care. And since they're not being released, they need to make sure that they're giving them proper care and they're testing everyone in the facility. They're not getting proper medical care. The most that they get is like an Advil and a temperature check. That's it. They're not checking they're not using the pulse oximeter to even check oxygen levels. And we all know that, COVID-19 is a respiratory disease. So that should be their first order of business is when somebody has symptoms is to check their oxygen levels. And they're not even getting that. They're just being left in solitary confinement or their cell with a roommate and not getting any medical care, just like having to kind of tough it out. And it is torture. It's inhumane and it's torture.
Medical care in state and federal prisons has long been a national disgrace, notoriously run down and underfunded. Most states contract out healthcare services to private companies that are often paid on a per minute and per inmate basis, creating the incentive to keep costs low as possible, leaving inmates with criminally inadequate care.
Corporations whose entire business model is premised upon getting paid as much money in taxpayer money and then providing as little medical care as possible, which is basically their profit margin. So I would say that overall, though, the medical care that prisoners in general around the country have is pretty horrific and probably among the worst in the industrialized world.
Incarcerated people are often made to pay $2 to $5 co-pays for doctor's visits, medications, and testing, earning wages at 14 to 63 cents per hour. This is the equivalent of charging someone a week's worth of labor for one visit. Only 3 states have waived these co-pays during the pandemic. The incarcerated population has higher than average rates of pre-existing conditions like diabetes and heart disease. And one jarring statistic, prisoners make up only 1% of the general population, yet they account for 35% of the nation's total cases of hepatitis C. A study by Columbia University found that 97% of inmates with hepatitis C don't receive the expensive medication they need. There are so many horror stories of healthcare in prisons that would qualify as criminal negligence and malpractice if it occurred anywhere else. But no one gets prosecuted or held accountable for it, as if no conditions are too cruel for those convicted of a crime. Along with everything else related to prisoners in our political system, the problem is out of sight, out of mind.
Make noise around what's going on in prisons. There are so many people across the country doing work in solidarity with people in prisons. It's really easy to get in touch with people and just make as much noise as possible and circulate demands and see what people incarcerated really want and need.
If the capitalists want to keep building prisons, we say they should lay in them. They should go live in the prisons. If you want to make your bed, then you lay in that bed. What we want to make is the real conditions for a socialist future, a future where life is precious, where you have a guaranteed right to a house, a guaranteed right to a job, a guaranteed right to quality education, a guaranteed right to quality healthcare. You put those 5 things together under a planned economy and you've annihilated the need for this completely irrational and depraved mass incarceration system. So I'd say they need organization, real movement on the inside, and they need organization and real movement on the outside. Because if we fight, we will win. If we do not struggle, we definitely will lose. And we will lose in the way of lives.